Bismillah ar-Rahman ar-Rahim. Alhamdulillah, wassalatu wassalamu ala Rasulullah. Assalamu alaikum wa rahmatullah, and welcome everybody to today's webinar, which is brought to you by BIMA, the British Islamic Medical Association, and the MCB, Muslim Council of Britain, and Care Not Killing. Today's webinar has been publicized is about the assisted suicide bill, which is about to go through its third reading through the UK Parliament. And we will be talking about that in a few minutes with our esteemed panelists who are all waiting to start the discussion shortly. My name is Arshad Latif. I'm a GP in Nottingham and have been closely involved with the whole campaign for the last few months. So let's start off quickly by describing what is assisted dying. You would have heard of the term euthanasia. It's derived from Greek. It's a combination of two words, which means good or well, and thanos or thanatos, which means death. So euthanasia literally means good death or easy death, implying a painless, peaceful death, often intended to relieve suffering in cases of terminal illness or severe pain. We'll be, of course, touching on different terminologies that are being used interchangeably. Some of them might have more to it than euthanasia. The push for assisted dying seems to be gaining momentum over the last 3 decades. As you will be aware, Netherlands was the first country to legalize euthanasia in 2002 with the passing of Termination of Life on Request and Assisted Suicide Act. And Belgium was the first country to legalize euthanasia for children in 2014. Netherlands legalized euthanasia for children over the age of 12 soon after Belgium. Other countries who have got some form or the other of euthanasia in place are Luxembourg, Colombia, Canada, Switzerland, Spain, New Zealand, and certain states in Australia. And then also in America. That's not an exhaustive list. And of course, we are aware that this is something which is being debated in the UK Parliament with the third reading due shortly. I'll be sharing some slides which have currently been put on by our esteemed panelists in a minute. And without further ado, I will start off by inviting our first panelist, our renowned palliative care consultant, Dr. Nadia Khan, who is a council member of the British Islamic Medical Association. She's been heavily involved in the advocacy work of BIMA, and especially the work around assisted dying campaign. Assalamu alaikum and welcome to the program, Sister Nadia.
Wa alaikum assalam wa rahmatullahi wa barakatuhu.
So you're on mute at the moment, Dr. Nadia?
Can you hear me now?
Yeah, we can hear you. Perfect.
Perfect. Wa alaikum assalam.
Okay.
Jazakallah khair.
Thank you for joining in. For the benefit of those who are attending, as you would have seen, the chat box is disabled for the participants, but you can still raise your questions using the Q&A tab, whether you're on your laptop or on your phone. So please do keep those questions coming in. We have got a lineup of 4 speakers followed by a Q&A session at the end. So we'll start off with Sister Nadia first, Dr. Nadia Khan, and I'll share the slides as well. Thank you. So over to you, Dr. Nadia Khan.
Jazakallah khair. Okay, assalamu alaikum everyone, and welcome to this really important briefing today around assisted suicide and the current action that we need to think about taking as a Muslim community and broader healthcare professionals as well. Next slide, please. So the summary session, if you could keep clicking, Brother Urshid, over the course of the next 15 minutes, we'll be thinking about what is assisted dying and will assisted dying be legalized within the UK setting? Why is assisted dying being introduced potentially within the UK setting? And what are our concerns and dangers around assisted dying being legalized? What are the professional concerns? And we will also touch on what's happening in other countries, particularly from the Canadian perspective with one of our esteemed speakers today. And importantly, what we need to do next, because this is very much a call for action. Next slide, please. So to begin with, inshallah, we'll just spend 1 minute just doing a temperature check of the room to see how we're all feeling and thinking around the topic of assisted dying. So Brother Urshid will start a poll, a Zoom poll for us. And I would be really grateful if you could just complete that over the next sort of 30, 40 seconds. Very brief, 5 questions. So just answer the question as you feel suits your best current point and perspective on assisted dying and assisted suicide. So the first question is just about whether you're a healthcare professional or not. The second question is how much information and how much knowledge you feel you have around what's happening currently with the assisted dying bill. The third question looks at what your own personal opinion is, and please be aware that this is all anonymous. So we can't identify you. So please do share with us what your own personal opinion is on that. And then the fourth question is whether you would be willing to email your MP about the issue, and currently whether you would be willing to visit your MP around assisted dying as an issue. So, but Arshad, I don't know if we can tell how many people have completed the poll, but if we can't, then another 20 seconds.
Yeah, sure. So we've had about 60 people participate so far, 31 out of 51 who are in the room. So if all can join in, that'd be great. We'll give you another extra 10 seconds.
Thank you. Okay, Jazakallah khair. Thank you for that. So we'll have a. I don't know if Brother Arshad can look at those results at the moment, or
yeah, we can. Yeah. So I'm displaying them now.
Okay, great. So in our room, we currently have nearly 4 out of 5 people are healthcare professionals. And most people feel like they have a little bit of knowledge around the assisted dying bill, but maybe not as much as what they were intending to have. So that's why they have joined our webinar today, which is fantastic. The vast majority of people are against assisted dying being legalized, but 10%, nearly 10% people need more information to make up their mind. So that's really helpful to know, and hopefully we will be able to fulfill that need for you today. And then we have over 80% of people who would be willing to email their MP about assisted dying pre-webinar, and then the rest sort of more or less need more information. Some people don't want to email, and that's absolutely fine as well. And then whether we would be willing to visit your MP. So nearly 40% of people would be willing to visit their MP, but over 30% may do. So perhaps this webinar will again help you to make up your mind as to whether that's something you would be interested in doing. Okay, Jazakallah, that's really helpful. Thank you very much. So onwards to the next slide. Okay, so I'm going to lay the context for our conversation today, and I think terminology is critical within this conversation. So what is assisted dying? There is a lot of misconception about what it means, and so that's why it's important to understand what the different terms are. Brother Urshid, we've lost our slides there. So whilst that comes back up again, so to begin with, assisted dying in our particular context is referring to the idea that people are given support and assisted with being prescribed lethal medication to take, which they can then administer themselves in order to end their own life. That's essentially what assisted dying means for us within the UK bill as it's being discussed. So that's assisted suicide. It's also called physician-assisted suicide as well. Euthanasia is, as Brother Urshid has already mentioned, is where healthcare staff directly actually administer the lethal medication to end a patient's life. So that is different to assisted suicide, and that's not what is being discussed in the current assisted dying bill. It's physician-assisted suicide, which is what is being put forward in Parliament, Westminster at the moment. Assisted dying usually can be an umbrella term, and it can relate to people with terminal illness who have the capacity to make decisions. So they are meant to be people who have sound mind and are able to obviously rationalize and make decisions, although this is changing somewhat in different jurisdictions around the world. which Sabira will talk about shortly in Canada. It is different to palliative care. So some people think assisted dying and palliative care are sort of the same thing, really. And actually, palliative care is a completely different approach. Palliative care is focused on improving every moment of life, improving quality of life, right up until the very natural end, and decreasing suffering. But there is no shortening of life or hastening of death intentionally made within the palliative care approach. So that's a very critical differentiation. Next slide, please. So will assisted dying be legalized, and do we need to be concerned about it as Muslims? So there is currently a bill, parliamentary bill, that is passing through Westminster, going through the process, which is looking to legalize assisted suicide within England and Wales. This has been, you may have seen media coverage of this, mainly, particularly in November of last year, when there was increased awareness and heightened interest because it was moving through the second reading, which is a particular stage of Parliament. The bill has just finished being scrutinised by a committee panel of MPs who have gone through it line by line to try and improve the safeguards within the bill. But that's been a very flawed process, as we'll come on to in more detail later. And it's now going to be presented back to Parliament again for a report stage, which will be at the end of April in a few weeks' time, and then for third reading, which is likely to be in May. Once that goes through, that's pretty much it being legalised or agreed by the House of Commons, but then it needs to go through the House of Lords. But that's once it's gone through the House of Commons, it's pretty much agreed that it will become legalised within the UK. I think for us, importantly as Muslims, I think as we've seen from our poll already, the vast majority of Muslims are on principle going to be against assisted suicide and assisted dying. And we probably won't accept it either for ourselves personally or for our family members. But then why are we speaking out about it, I guess, is the important question to ask as well. And I feel very strongly that although, yes, it might not be something we as a community will accept, we do have a duty as part of our own being and our religion to speak out for the public good, for the society that we live in, to ensure that our neighbours are living as best they can. And we have a duty of care more broadly than just our Muslim community. And very much for this bill, even though we think directly there won't be much impact for us, there will be indirect consequences for all of society. And that's really important for us to be aware of as well. Next slide, please. So why is assisted dying being introduced? So the main two key arguments that the proponents of the assisted dying bill have is that, argument one is that it's to reduce or end suffering that's occurring at the end of life. So that's one argument. And argument two is very much focused on the concept of choice and control. So we know when you do society polls, particularly in Western societies, choice and control over matters of life and now death as well are quite paramount. And so this is really an extension of those sort of liberal arguments, if you wish to sort of think of it in that way. So this is very much the thrust of the arguments that you will see for the people who are pro-assisted dying. We know also that the main healthcare costs of people are in the last year of life. So this is really when they have recurrent hospital admissions, very complex, potentially complicated healthcare interventions. And we also know that hospices who do provide palliative or conventional end-of-life care, they are under immense financial pressure in the UK at the moment, and services are being cut left, right, and centre. So that's a broader context that we need to be aware of when it comes to thinking about the bill and why it might be being introduced. Next slide, please. So you may say, well, actually, these arguments, is there some validity to these arguments? And obviously, the proponents of the assisted dying bill are very much focused on that idea of autonomy, choice, and reduction of suffering. And in and of themselves, you can see the logic of it, particularly for people who may have seen poor suffering, seen difficult end-of-life care scenarios, or very much feel that sense of autonomy on their body, my choice, that sort of perspective. However, for particularly from our perspective, there is important pushback to these particular arguments. In terms of suffering relief, one of the key problems that we have at the moment is that suffering that could be managed at the moment in society is not being done well at all. High quality, round the clock palliative care is not available to everyone. It's very much a postcode lottery. It's very much dependent on your financial status, your social status, your ethnic minority status or not. All of these factors which are also prevalent in other health inequity medical scenarios as well. We know that there's not enough staff, there's not enough training around palliative care. So it's not just about specialist palliative care, but it's also about generalist palliative care as well. We simply don't have the workforce trained up and require they're present to meet the requirement that there is for palliative care. We know that palliative care, when it's done well, is effective at reducing suffering in terminal illness. And as a palliative care consultant in a hospice, I am very aware of the type of complex interventions and medications that I have access to in that setting that really does make a difference to very even refractory and complicated challenges at the end of life. But not everyone accesses or has access to that. And that needs to be available in order for there to be true choice and true autonomy. How can we, otherwise we're presenting a false argument. Secondly, in terms of choice and control, yes, there may be an element of choice being given to certain people within society if they wish to end their lives with the help of physician assistance. However, this legalization of choice, I would argue, cannot come at the cost of putting other people at risk and restricting other people's free choice, which is what this bill will do in terms of implications and consequences. Next slide, please. Okay, so I am going to maybe just skip this slide because Naomi is going to talk about this in more detail. So I'm just conscious of time, Brother Arshad. And if we go on to the next slide. So in terms of the professional concerns that we have, we know that it can be very difficult to predict when death is near. And that's going to be one of the problems with the bill because it's meant to be for people of 6 months prognosis and less, but that's very unclear. And it's also difficult for healthcare professionals to ensure that a person has mental capacity as well. So this comes back to the point I was making earlier. How do we ensure that it's capacity, people with capacity who actually undertake assisted dying? It's not clear cut. And we know that from our day-to-day healthcare encounters with people, how grey it can be around capacity. Next slide, please. And also, yes, it's difficult for healthcare professionals to assess that a patient's not being coerced or pressurized into undertaking assisted dying, which is what part of this bill is meant to try and do. But we feel that the safeguards are very, very shaky on this. Next slide, please. Oh, and ethical concerns. So there's a lot of problems with the bill, essentially, but ethical concerns, especially around the impact for what medicine and medical professionals are there to do, that ethos, the ability to develop trust with patients and for patients to feel confident that doctors have their best interests at heart and don't have a hidden agenda around assisted dying being introduced or suggested is important. Okay. Next slide, please. Okay. Many of the healthcare professionals will be indirectly involved, even when they don't want to be. And there is the potential for medical complications to occur during assisted dying as well. And we know that within our communities, there's already an issue around medical mistrust. And we saw some of this emerge quite dramatically during the COVID-19 pandemic. Our concern is that relatively poor access is happening to palliative care from our communities already is going to be completely diminished by the fear that our communities will have around what hospice care means, especially if they're institutions that will end up offering assisted dying. Next slide, please. Okay. So the bill, which now we'll talk about in more detail, promises choice for the terminally ill. However, it's not as simple as that. It's much more complicated. And this is where the real detail, the devil in the detail is we need to be able to understand and be able to raise our concerns about with the MPs. And the impact is going to be much greater for marginalized and vulnerable communities who may be forced into assisted dying. I'll hand over to Naomi.
Thank you so much, Dr. Nadia Khan, for that quick whiz tour of the challenges with the assisted dying bill and our perspective on that. This is Dr. Naomi Green, again, mashallah, very well-known individual in our community. She's got background in medical genetics. She holds a PhD in social sciences, specializing in issues impacting Muslim communities in Northern Ireland. She is an independent researcher and lecturer. Her focus is mainly on Islamophobia, Muslim communities, and social integration. She's actively engaged in community relations and advocacy, serving an executive board of Northern Ireland Interfaith Forum, and also has been really deeply involved as the National Council member of the Muslim Council of Britain. So welcome to the program, Dr. Naomi Green, and over to you.
Thank you very much. Assalamu alaikum. So I'm going to give a little bit of a non-medical perspective on this bill. As Sister Nadia has already talked about, the end of life bill, it promises choice. But the deeper reality is far more complex and quite unsettling. As Muslims, we have both religious and societal reasons to pause and to question and challenge what this bill actually entails. And it's very likely that it will cause more harm, especially for those who are already marginalised or reliant on supportive care. And some people might ask, why are we opposing something that will reduce suffering? It's a fair question because nobody wants to see their loved ones in pain. Yet the bill, as it stands, is actually riddled with loopholes and glaring omissions that risk undermining the very compassion it claims to offer. Moreover, there's an urgent concern that society has shifted away from caring for the vulnerable towards one that not only undervalues empathy, but sometimes even mocks it. And we've seen that with the recent changes in the disability benefits and some of the commentary that we have seen around that. And it feels that we've reached a point in society where we devalue those who require extra support, and people are disabled, and also the people that care for them, labeling it as too much and too much of a burden on society. And that's a very dangerous path that we're going down. So, of course, from an Islamic perspective, we believe that life is a sacred trust from God, and that we are stewards of our body, not absolute owners who can do whatever we want. Our time of death is in, of course, God's hand. We also believe that every human life has intrinsic value, not based on the perceived worth that society says that someone may bring to society. And the problem with assisted dying is it challenges this very principle. It impacts not only how some people may view their own worth, but also how we, as a wider society, may view people in this position. This doesn't mean that we're dismissing suffering. Islam emphasizes mercy, and in the context of end-of-life care, this means giving people hope. It means providing people with high-quality end-of-life care and community support for those who need it. And we're not alone. There are other faith communities who also stress the sanctity of life, and there are many Christians and other faiths who are also campaigning against this bill. And there are also people from all faiths and no faith who are recognising the dangers of normalising assisted death, particularly in a society that isn't fully prepared to protect its most vulnerable. Next slide, please. So there are many key problems in the bill. The bill has now passed 2 readings. So that means as a private member's bill, it's gone through the House of Commons twice. It's then proceeded to the committee stage, and that process is now concluded. So as Sister Nadia said, they've gone through the bill and they have made various changes. The promise was that this process would strengthen the safeguards that were in the initial bill, but many have actually been weakened. And it's raising even more concerns and ethical and procedural concerns with the bill. And that's why we're asking you today to take action and to contact your MP to make sure when it comes back to the House of Commons at the 3rd reading that they're prepared to oppose it. So there's just a few of the most troubling aspects. Whenever a doctor is assessing capacity, so when they're deciding if someone is in a position to decide to take assisted dying, they only need to be 51% sure. So, they could be 50-50 and it just weighs over to the side of assisted dying. And, people change their minds. People who have had terminal diagnosis, they may be living in a period of very high stress, and they're not able necessarily to make a decision in that kind of condition, and they need time to think about it. So it can lead to mistakes, especially for people who may be suffering from mental illness or memory problems. It's also so wide that even people with learning difficulties or other mental health challenges that can fluctuate, those who feel like a burden might qualify. And particularly if they don't have access to proper care. And as Sister Nadia already outlined, there's a lot of people in our communities and in society who are not receiving adequate palliative care. And that leads to fear, and that can also contribute to people's decision making. And patients can qualify just by refusing treatment. If someone decides that they don't want to continue with their chemotherapy or whatever the treatment that they're getting, even it means that they can then be pushed down this pathway, and their family may not find out until the patient has actually died. So there's no chance to check for any pressure or coercion. And any doctor, even if they don't have specialist training in this area, will be able to suggest assisted dying, even for minors and even for people with disabilities, which again raises serious concerns about protecting vulnerable groups. The process, therefore, is open to doctor shopping. Someone could go to a doctor who doesn't really know them until they get someone who can grant them approval, which means approval would be obtained by persistence rather than the medical necessity that we see, the 6 months qualifier. And as again, Sister Nadia said, it can be really hard to determine how long someone has if they have a terminal illness. And there's a weak oversight. One of the provisions that the initial bill had said was that there was going to be high court oversight, which is currently needed if someone is withdrawing care, for example, if they're on life support. And that's been completely scrapped. It's now going to be a panel that may not even hold a live hearing. They could just simply vote by majority. They may not ever meet the patient. And the whole process is going to be overseen by a commissioner who's going to answer only to the health secretary. So again, so many potential for conflicts of interest, and very little rules about who can give the drugs. Again, government ministers can go and change the system later on with very, very little oversight in legislation. And even with all these major issues unresolved, in 4 years, this law would automatically come into effect, and all care facilities, including hospices and care homes, will be expected to comply or face penalties. So even if they have a particular ethos that they would not generally support, the staff would not support assisted dying, they will be obligated to give this choice to patients. Next page, please, or next slide, please. So to sum this up, this paints a picture of inadequate safeguards and a framework that could easily slip towards coercion or abuse, particularly among those who already feel unwanted or burdensome. And we have this broader pathologization of empathy. Society as a whole, outside of the Muslim community, not just, it's turned to something that's very efficiency driven. If you care too deep, it's oversensitivity, it's too emotional. Empathy itself and compassion is devalued. And we're increasingly seeing vulnerable individuals as problems to be managed, burdens to be relieved, rather than human beings. And this bill, however good intentions many people have in supporting it, it risks reinforcing that mindset, making it simpler to end a life rather than to care for it. And with existing racial disparities, domestic abuse, elder abuse, disability abuse, there's a significant risk of coercion. And it's not just about that individual. It's about how society and institutions provide care, allocate resources, fund palliative care. In the UK, many people have become disconnected from the actual process of dying. Of course, in the Muslim tradition and other traditional communities, burying the deceased happens very, very quickly. We maintain very close contact with the body, we do ghusl. But in broader society, weeks can often happen between the death and the funeral, which has removed many people from that natural dying process and the reality of death. And that has bred fear. And the fear of a painful death has overshadowed discussion of proper palliative care or emotional and spiritual support. So if death is scary, then let's just get over with. And that is driving a lot of the support for this bill. But what if that fear is driven by misunderstanding, treatable pain, or loneliness? And we're going to hear shortly about the situation in Canada and how far down that path they have gone. And it's expanded to include far more conditions than originally intended. And this is the mission creep that we're also afraid that could happen, and that many are warning us about from their experiences in other countries. If we open the door with inadequate safeguards, it may be just impossible to close that door again and to protect those who are most vulnerable. The next slide. So what can we do? Well, first of all, we're not alone in our concerns. There's churches, there's disability rights groups, there's various grassroots coalitions, and we have Gillian with us, who's going to speak later, who've been actively challenging this bill through email campaigns, petitions, and public awareness initiatives. And we too, as a Muslim community, we need to engage in this. We need to spread the word. We need to share accurate information within your families, your mosques, your community centres, your WhatsApp groups. We need to pay attention. It can be very difficult. The language is very heavy. It's very medicalised. It can be very difficult to understand the specifics of the bill. And some of the headlines have really simplifies what's really, really going on. But there's a lot of resources on our BEMA website that we will guide you to that can explain more about the more intricate level of the bill. So we want you to contact your MP, and again, you're going to hear later on how to do that. But it's really important that you make your voice heard, because the bill, as it's currently framed, risks replacing genuine compassion with a bureaucratic one-way path to ending life. Do we value human life, or do we sideline those who society has deemed less? And we all need to work together across faiths, across professional backgrounds, across communities to prioritise the sanctity of life, protect the vulnerable, and uphold the principle that caring for each other is not our weakness, but our greatest strength. Thank you.
Thank you so much, Dr. Naomi Grain. Jazakallah khairan. Really pertinent points, and you were really thorough in raising all the concerns that have been raised by healthcare professionals as well as the general community members, not just Muslims, but also people of faith or no faith. So after having gone to Birmingham, then to Northern Ireland, it's time to go to Canada, Mississauga to be more specific. We're joined by another esteemed colleague, Dr. Sabra Kanani. She is currently the co-head of services for palliative care at the Hamilton Health Sciences, and an assistant clinical professor in the Department of Family Medicine. She's originally from Birmingham, decided to go to Australia for a couple of years, trained in palliative care, and has been in Canada since 2011. This is Sabra Kanani. If I can request you to kindly turn your video on. Great, we can see you all. Over to you. Thank you so much for joining us.
Thank you so much for having me today. It's been really interesting to listen to this and really hear the same conversations and concerns that we had in Canada being expressed in the UK as well. Let's go to the next slide. Excellent. So I'm going to be talking about medical assistance in dying and the legislation that went through in Canada and what the lay of the land looks like. So medical assistance in dying became legal in Canada as of June 2016. And the first people to receive medical assistance in dying happened very soon after. And its popularity has been growing year by year, and more people have actually been requesting medical assistance in dying. I just wanted to go through a little bit of the legislation and the bill, because this will talk to the same sort of concerns that are being expressed about the bill that's currently going through the UK Parliament. So the eligibility criteria for medical assistance in dying is that you have to be eligible for health services funded by the Government of Canada. As of right now, you have to be at least 18 years of age and capable of making decisions with respect to your health. And you have to have a grievous and irremediable medical condition, and this was quite vague in the bill, and they did expand on it a little bit, and we're going to go through that in the next slide, but we can kind of talk about the vagueness and how it's quite subjective. The person themselves has to make a voluntary request for medical assistance in dying, and you can't have made that request as a result of external pressure. You have to give informed consent to receive medical assistance in dying, and you have to be informed of all the options, which included palliative care. Can we go into the next slide, please? So as I said, that kind of term, grievous and irremediable medical condition, is quite a vague term, and that was very much debated as the legislation was going through, and they did eventually give a little bit more kind of guidance as to what that meant. It said you have to have a serious, incurable illness, disease, or disability. Interestingly enough, they didn't include prognosis in the bill, and they said it was up to the medical practitioners who were doing the assessments to determine whether the illness itself was serious and incurable, and that it was in an advanced state of irreversible decline in capability, and that it caused endurable physical or psychological suffering that is intolerable to the person and cannot be relieved under conditions that they consider acceptable. So that was a big thing as well. It's not whether the medical professional considered whether or not they could relieve the suffering. It was whether the patient themselves thought they could kind of endure the suffering or not, and that their natural death has become reasonably foreseeable, taking into account all their medical circumstances without a prognosis necessarily having been made as to the specific length of time that they have remaining. So you can see it's kind of gives some guidance, but there's lots of scope for whoever is doing the assessments to kind of determine what they deem as acceptable or not. Let's go on to the next slide, please. So how does the process go here in Canada? So, for example, I work in the hospital, and a patient may kind of talk to me and say that, you know what, they're interested in medical assistance in dying. If they are interested, in the hospital, I typically refer onto the ward social workers, and they kind of work through consent with the patient. So there's a form that the patient has to go through, and it has to be a written request signed by an independent witness. As of now, it's one independent witness, and previously it actually used to be two independent witnesses. And then after that, two independent medical assessments have to be done. The first assessment is always has to be done by a medical professional who has been within the patient's circle of care. So it can be kind of a GP, it can be a specialist, but somebody who has been involved in their care. And the second assessment is usually done by the medical practitioner who will be carrying out the provision. So here in Canada, medical assistance in dying is done by administering intravenous medications to the patient. So it's usually the person who's doing the provision who has to do the second assessment. And the person must be able to provide final consent or withdraw consent at any time. And so that's important as well. Can we go to the next slide, please? And I think as it's been talked about, kind of initially kind of the bill was very kind of much set, but then changes happened in 2021 where they actually expanded the eligibility criteria to include persons whose death is not reasonably foreseeable, with some supposedly expanded safeguards. So again, it needed appropriate consultation to kind of understand the patient's kind of concerns and why they feel that they're kind of suffering. And here, even though you went through an assessment and you were deemed eligible, you have to go through a 90-day wait period. So after the first assessment, you have to undergo a 90-day wait period. If this is still kind of what you felt you wanted to do, then you could carry on to the second assessment and have the provision. And this bill also included easing of safeguards for persons whose natural death is foreseeable. So as I said before, we needed 2 witnesses to start the process. Now this has been put down to 1 witness. Initially, at the beginning, there was a 10-day reflection period after you signed the initial consent to allow you time to reflect and kind of decide and kind of really get into your mind that this is what you wanted to do. That 10-day reflection period has been completely eliminated now. So this process can go as quick as the patient wants or the medical system can allow. So, you know, a patient may decide that they want MAID right now, and it could really be assessment 1 on day 1, assessment 2 on day 2, and the provision itself taking place on day 3. In reality, it doesn't really happen that quickly because it just takes time to get everybody together and get the whole process in place. But really, it could be as quick as that. And I have seen it in a few occasions as quickly as that. Previously, the patient had to give consent right before the procedure. So they had to have capacity right before the procedure was done. And if you lost capacity, you could not go through the MAID procedure, even though you had expressed a wish and gone through the assessments. But now what's happening is they allow written arrangements so that final express consent can be waived if the patient loses capacity. So usually what happens is after the second assessment, if the patient is deemed eligible, the person who's there doing the second assessment and who will be doing the provision gets the patient to sign consent that they agree to MAID, and they set a date and they sign that consent. And even if the patient loses capacity, MAID will continue on the kind of the date that's been agreed upon. Can we go to the next slide, please? So I did want to talk a little bit about conscientious objection, because of course, as Muslims, we do not necessarily want to participate in this process. And Canadian law definitely recognizes the right of medical practitioners to conscientious objection. However, they still have a duty to ensure the patient's care is not compromised, and we're expected to ensure safe and timely transfer of care to another medical professional. How that's actualized is that in the hospital setting, it's very easy. Each hospital typically has a MAID team. So I typically kind of refer on to the social worker, who then refers on to the MAID team. In the community, again, there's usually MAID teams available. So in the community, the physician who kind of this comes to would refer directly to the MAID team. Or what provinces have done is they've put out a 1-800 number that people can call at any time and get kind of referred directly to the MAID team themselves if they don't want to go through a medical practitioner. Next slide, please. So what impact has MAID had on the Muslim community? I think it's been really interesting. As MAID has become more popular in the general population in Canada, the Muslim community has been asking more and more about it. And I will say there have been people from the Muslim community who have undergone MAID and are interested in MAID. And it's been a struggle because religious scholars haven't really been kind of aware of what to deal with it, and the wider community haven't really been educated on it. And we've definitely needed to do a whole lot more education. So I've been having conversations with religious kind of scholars, Muslim chaplains, talking about the difference between palliative care, palliative sedation, and MAID. And we've been going out to mosques and talking to them about MAID and what it is, and talking about the Islamic perspective on MAID and death and dying. So it's really opened up the conversations to kind of finding out kind of what is acceptable for people and what's not. And I think what I've learned is if you don't think it's going to impact you as a Muslim community, it really is going to impact you as a Muslim community, even if you don't expect it to. So that's my perspective kind of from Canada.
Thank you so much for that insight from Canada, and those of us who've been following it from afar can clearly see how this is in fact a slippery slope, and something that we should be concerned about, and definitely should be willing to talk about more openly. Just taking the discussion further, we have got Dr. Gillian Wright, who is a former palliative care doctor. She has changed her work recently to medical ethics as a researcher. She now works for a group called Our Duty of Care, which is a campaign of healthcare professionals who are opposed to assisted dying. Assisted suicide. We're going to be hearing more from her. So welcome to the program, Dr. Gillian Wright. Really pleased to have you today.
Oh, thank you so much for having me. It's a real pleasure and a really helpful webinar, actually. I find it really helpful to hear the different perspectives, and it's really concerning to hear that there might be a number for people to call in Canada, that they would get direct access to this. Thanks so much. Please, let's have the next slide. As was introduced, I used to be a palliative care doctor, but over the last 4 years, I've been working for a campaign group to try and raise awareness and to encourage particularly healthcare professionals, but actually the wider community as well, that this is a big issue and that it's really important that we do engage with our politicians. And I'm just so delighted to be here because the timing is perfect. The bill in England and Wales has been going through the Westminster Parliament, and it's just finished the committee stage, as Nadia said. So we have about 3 or 4 weeks until what's called the third, the report stage, which will be 25th of April. It may be that we have a vote even on that day, although we're expecting it to be a little later now in May. And so it's really important. There are about 650 MPs, and many of them are not experts on palliative care, they're not experts on health, but they are really concerned about this issue. And it's so important that we can engage with them and write to them and speak with them to explain exactly what the problems are. And absolutely, just now is a really important time because they're just about to go on holiday. And so we've got about 2 weeks when they will be based much more in their constituency, and they will be seeing their constituents about lots of different issues. So now is the time to write to them or to try and get an appointment to speak with them. What I would like to say is really just to encourage you to do that. Probably 2 or 3 years ago, I hadn't spoken to any MPs, and I've probably spoken to more Scottish, as you probably can tell, members of the Scottish Parliament. But actually, I found it a really interesting and helpful thing to do. What we try and do is to ask them a little bit about what their thoughts are on the bill. What are they interested in? What are their concerns about the bill, and really build on that. I would really encourage you to go with a colleague, go with a friend, so that there's 2 of you, because often MPs will have a member of staff with them. So they will often have 2 of them, and it's nice to have a conversation that perhaps 2 of you from different perspectives. You can talk about perhaps looking after an unwell relative, or perhaps you can talk about your work. Next slide, thanks. What I would really encourage you to do is it is worth doing a little bit of preparation. And I know BEMA have lots of resources on their website, and we've heard about a lot of them today. So perhaps just choose 2 or 3 issues. It's difficult to remember everything in the heat of the moment, but I find that quite often there's a number that begin with the letter C. So sometimes I just jot them down on a bit of paper before I go in. So one would be the crisis in the NHS. Just as Nadia talked about, how can we bring in assisted suicide when we aren't providing the palliative care that people need? And you can talk about perhaps family experiences of not getting mental health support or psychological support or palliative care support that perhaps they needed. Or you can talk as a professional about the gaps that you can identify in your services. It's much more effective just to talk about what you know rather than learning up lots of facts. A second thing would be about something like choice. Is it a real choice? Perhaps someone's being coerced. That's another C. And then my third C is often Canada. Just to look at the example of how quickly things expanded in Canada. What was promised as a very narrow bill rapidly expanded to include those who are much more vulnerable. So those big issues, capacity, coercion, consequences, Canada, NHS crisis, they're my kind of notes that I jot down. Sometimes I also take something with me. So perhaps the medics, you could take an article. There's resources on our website, or I'm sure Bima will be able to point you to the right things as well. Perhaps just a 2-page editorial, something helpful, just to leave with the MP. Sometimes I've gone to speak to them and they've not managed to come. They've been tied up with something else. So it's helpful just to leave some resources or an article to leave with them and say perhaps they could read it another time and make another appointment. So there's lots you can do in quite a short space of time, but with 4 weeks to go, the main thing we need to do is see your MP. Thank you so much. Absolutely, organise as communities, and it's really important to tell your friends and family. So perhaps send them the links, just mention that you've been at this webinar, ask them what they think, and I would encourage you. This is a difficult and sensitive topic, and I know people find it difficult. Even in the questions, you can see that we are struggling with this, and so that's a way in just to explore people's experiences and struggles, and just think about what this law might mean for the whole of society. It's not just for individuals; it's for everyone. So I don't want to take up too much time, but thank you so much for having me. And also just to say that we're delighted to help. We know there's resources on the BIMA website. The QR code's just coming up now. We certainly have resources on our website, which is ourdutyofcare.org.uk. And I know Nadia would be glad to help. I know she's busy working, but if you are going to see perhaps an MP and you're feeling a little anxious, then there are a number of us who'd be delighted just to talk with you, perhaps the day before, or just to run through what you're thinking, or just to answer any questions that you might have before you go in. So please do reach out, and others are really glad to share what they've been doing and to share their ideas too. So thank you so much for having me.
Thank you so much, Gillian, and please don't disappear. We will have a quick panel discussion now, and of course you can see all the QR codes there. If you can scan it, that's great. If you are struggling because you're using the same device, then we'll share the link to those groups in the chat box shortly. So please do keep those questions coming in. Some really interesting questions. A lot of them have been answered by Naomi and Nadia and other colleagues already. Perhaps if I can start off with yourself, Gillian, and something which is quite sensitive. A question about being a healthcare professional who's conscientiously objected in terms of supporting assisted dying if it was to become a law.
Mm.
How would you
Yeah.
approach that?
Yes, and there have been reassurances within the bill itself that those who are directly involved won't have to participate. So there is provision for those who have conscientious objection for any reason, that they do not have to participate. I think our wider concerns are that that possibly does afford protection to the doctor, but we would have concerns for those on the team. So perhaps the nurses, the pharmacists, concerns for the administrative staff who will look after the whole person. And I think we are concerned particularly for how this will impact on others. It's also just the wider implications. I was speaking to a hospice director, and she was saying she wouldn't want to be involved directly, but she does have administrative responsibility for the whole hospice. So would she be involved therefore for providing this in a sense? And could she opt out of those kind of rotas or those kind of responsibilities? So you can see how people could be conflicted in a number of ways. And she said, well, would I really want to have this role continuing? So you can see that there are a number of difficulties with this, but ostensibly there is maintenance in the bill for this. But it's also helpful for people to hear that that's important to you and that you would like that to be upheld really clearly.
So what we're going to do is we're going to rerun the poll. It's just to give us an idea as to how the people found today's webinar. So just to give us an idea whether you listening in today helped you make up your mind. So we've got the pre-poll and the post-poll comparison to do, inshallah. So if you can kindly take a few seconds to fill out the questionnaire again, that would be great. So give you 30 seconds for that. Okay, we'll give you 10 more seconds and then we'll close the poll. So about 60% of people have responded. So that's great. So I'm just going to end the poll now. Dr. Nadia Khan, over to you to interpret those results. I think you can see certainly that numbers are a bit up now compared to pre.
Thank you. I can't see the poll results. I don't know if you can share those at all. Oh, perfect. Thank you. Yes, so let's see. So yes, we can see that definitely in the knowledge around the assisted dying bill has gone up from where we were previously. And now there is less agreement around assisted dying being legalized. We also see there has been a massive improvement in a willingness to email your MP. So I will talk about that in more detail just now because it's really important that we engage on this issue. Not doing anything is not an option because this is our chance to actually impact and shift the needle. And somebody asked a question around that as well. Will this really make a difference? And that's important. So thank you very much for engaging with that poll. Brother Rashid, would you, sorry, put that screen back up again? Because I think one or two people wanted to just also connect into the WhatsApp groups. So the QR codes are on the screen in a minute. This QR code at the top will take you to our very easy to use 2-minute email template. So you don't even need to know who your MP is. You just put in your postcode and it automates it for you. And you can choose whether you're a healthcare professional or not. And then there will be a crafted email, which I've been involved in developing. All you need to do is just make a few small edits in terms of if you're a healthcare professional, what your specialty role is. And then you just click send and it goes, and that's it done. The really important thing is that we get this out into our networks as well. So we need as many people from the community, we need our civic organizations, we need our healthcare professionals to actually engage, and it takes 2 minutes to do. So BEMA will be running a campaign around this as well over the next 2-3 weeks to really boost the profile. So apologies if you hear about it again and again, but it's really important that we do get that message out because there's still a lack of awareness around this issue. And so to help with that, we have set up a BEMA assisted suicide broadcast list. So you won't be spammed on this, but you will get updates so that inshallah, you can keep in touch with when we need to have key actions, because this is very much sort of, this is a political campaign, but it will impact us as medical doctors. So there's lots of information on the website. Please do just Google BEMA assisted dying and you'll see plenty of resources. You'll see our position statements. You'll see our pre-recorded webinars. This webinar will also be on the YouTube channel for BEMA as well. So you can replay it, or you can forward on the link to other people who might be interested. And Care Not Killing and Our Duty of Care, which are the organisations that Gillian is representing today, they have done some fantastic work around resources as well. Just for that broader understanding. So really, I would urge you to please engage with this. The MPs haven't made up their minds. This is something that still we can impact on. Many MPs are, they may have gone along with it in principle because society seems to want this, but the more the bill is being understood, the more issues and the more dangers are becoming apparent to it. So we really need to engage our MPs and discuss this further with them. So that's my ending point. We will be sending out to everyone who has registered for this webinar, we will be sending out a follow-up email with all those links and information. So if you haven't caught it, don't worry, we will be sending that out.
Thank you so much, Dr. Nadia Khan. I think most questions have been answered. In fact, all of them have been answered. So that's great. If anyone has got any questions, now you've got a chance to raise your hand and you can ask a question live from our panelists. Whilst we give you that opportunity, if I can take a few last comments from our panelists here as to what they would like to say and share. So starting with Dr. Sabra Kanani, any last comments, suggestions?
I think what's been said already, it's really important to do the advocacy because there are, I'm sure, just like in Canada, many other groups that are very much pro-assisted dying, and really the other side has to be heard. And as you can see, it can be quite a slippery slope. So really, I would encourage the advocacy work.
Thank you. Dr. Naomi Green.
Yeah, I think just echoing everything that's been said, it's very easy to think, well, I'm just one person, but everyone can take a step, and there's been a lot of push from the other side for this, and it's really framed the narrative. And when you look into it, as we've shown tonight, there's a lot more to it, and that fear of mission creep. So don't be afraid to go speak to your MP, write to your MP, talk about it in your circles. Have uncomfortable conversations. It's never easy to talk about dying, but it's important that we do. And inshallah, we will be heard. Thank you.
Thank you. And yeah, just on that point, I can see a number of senior colleagues from various organizations joined the webinar today. So people from National Barrier Council, people from Council of Mosques, some local councillors as well. So I can recognize a few names. So great to have you all here, and hope you can amplify the message for us. That would be great. Gillian, any final thoughts from you?
Just to say that I think MPs are listening to constituents, not all, but a significant number are finding this a difficult issue, and they are actually grateful to know what their constituents think. And actually, a number have just not had a chance to think it through. So I went to see one, and I said, "Oh, I'm concerned about coercion," and he genuinely hadn't really thought that through before. So you may think you don't know an awful lot about it, but actually, giving them the opportunity to think about it, you can change someone's mind. So I would really encourage you to go and have a discussion with them. Many thanks.
Thank you. Dr. Nadia Khan, we got a couple of people with hands up. Shall we take those questions before we wrap it?
Yes, happy to.
Yeah, thank you. So Nazir Bhatt, if you can kindly unmute yourself. You should be able to unmute now.
Hi, can you hear me?
Yes, we can. Thank you.
Right. Thank you, guys. Very informative webinar. A comment first. I am a head and neck surgeon and deal with people who are terminally ill with the head and neck cancer, and there we do practice an element of medical euthanasia in this country. Really, when patients come to us in the last few days with bleeding, massive bleedings, massive respiratory problems, we do give them midazolam drips and make them peacefully die. Really, so that's one comment. The other comment I just wanted to make is that religious groups will be more effective if they work together as a joint group rather than on their own isolation. And we as Muslims don't want to be identified as a group who is opposing something which the wider society, there's a lot of acceptance in it.
Thank you for those comments. I think your question has been partly answered during the webinar. If I can take the liberty to repeat some of the points that were raised. This is not a Muslim issue that we are raising as BIMA, as British Islamic Medical Association. We are bringing the Islamic perspective into play, but as been discussed in a bit of detail in your webinar, it's not just Muslims, but people of other faith or no faith who have got serious concerns about the legislation. So just want to push back on that narrative there. But yes, I completely agree with some of the points you've raised. And I probably would like to challenge the difference between palliative care and euthanasia, which are very different areas, really. They are completely different points, and we can't really compare the two together. In Islam as well, when treatment is futile, there's a place for keeping people comfortable. And that is from Islamic teaching. Again, I'm not a scholar, I'm not a mufti, but we have done webinars with Al Balagh Academy. They do their own fiqh of medicine, quite a detailed course where they touch in a lot of detail on that. But thank you so much for your points. Really appreciate those. We'll probably take one more question and then we'll hand over to Dr. Nadia for closure. So Maryam bint Suleiman.
Assalamu alaikum.
Wa alaikum assalam wa rahmatullah.
Okay, well, my question is that I'm a mother and a carer, and I have my son who has long-term illnesses. He's had quite a few heart surgeries, and we have, we struggle with mental health and long-term, chronic conditions. So my question is that when we actually go through those moments in surgery when we are told to sign documentation, we're too worried about the surgery. Our mind is focused on how the surgery will go for my son. So we're not really reading the contracts of what we are signing, and that's really concerning for me as a mother and for my son too, because sometimes we don't know what we are signing, and they tell us, they give us that information that, if something happens, we're not responsible. So, but at that moment, we're not really thinking. So this is really concerning for many of us who are carers, looking after our loved ones. And in that moment of anxiety, of worrying about surgery, and we're not knowing what's happening. So is it possible at those moments that we can, without knowing, sign something which could, lead to something that's, endangers the patient's life? And what can be done about that? Thank you.
Yeah, I think I'll let Gillian answer that and then hand over to Dr. Nadia Khan. Thank you, Dr. Gillian.
I'd want to reassure you that that shouldn't happen, and that the doctors on the call and others would really hope that that wouldn't. But I think that's one of the real concerns about legislation like this, is that people, when they're stressed, and I have caring responsibilities too, and when we're stressed and distressed, it's very difficult to know what you're signing and what you're not, and so I think what you want is the lines to be very clear, so that people are absolutely sure what the doctor can do and what they can't do. And I suppose from that point of view, I think it's very important that the law needs to be very clear for everyone, to keep the doctors right, but also to help patients, so that family members, so that they're not anxious about seeking help. And I think that would be one of my concerns, is that people might be anxious about seeking help, or going to a hospice, if this was more widespread. So I thank you. I think that's a really helpful comment.
Thank you. Dr. Khan, over to you and for final comments.
Jazakallah khair. I just want to answer a quick question that Sister Ruma has put on around information of posters or summary sheets that can be shared via WhatsApp. And you're absolutely right, the reach through WhatsApp and social media is really important around this. So this will be part of our 3-week campaign. It might be even a little bit more extended than that, by BEMA. So please do join the WhatsApp broadcast list, because we will be filtering all the information. We're producing small short videos, for example, like 1-minute videos, just to help people to understand the key problems, for example, and then you can just essentially send it on through your WhatsApp networks and through social media, inshallah. So please do join that link. We will send it out in a follow-up email to this webinar. I hope that I've been able to answer the vast majority of questions. And inshallah, if there are any further questions, you are more than welcome to get in contact with us at BEMA through the website. And we would be really, really happy to engage with any civic organizations who want to push this message out. Inshallah, if we can get people to engage with their local masajid, think about even having a khutbah on the issue, really just get that momentum going. And the Muslim Council of Britain will be, inshallah, very helpful for this. So Jazakallah khair for your time, and I really appreciate the evening that you have given this time up for, and inshallah we will be of service again in the near future.
Thank you so much to all the panelists who took their precious time out today to educate the community and to share their concerns, and also the way forward as to how we can act together, not just people of Muslim faith, but of all faiths and no faith. So just leaving this slide at the end for everyone to scan and join the group. And also, if you wanted to kind of write to a MP, there is a link. You can just scan the code and go to that particular link and simply just put your name and identify who your MP is, and pretty straightforward process, really. Do remember to visit our website, which has got a lot of useful resources. We will be, as Dr. Nadia Khan mentioned, doing more programs on this. So do keep in touch by visiting our website, www.britishima.org. Thank you so much once again for joining this live webinar today. Inshallah, speak to you soon and have a good evening. Assalamu alaikum wa rahmatullahi wa barakatuhu.